Hello and welcome back. Today we will be talking about non-hormonal medications that have shown efficacy in treating the symptoms of the menopause. Women who are having symptoms of the menopause may either elect to use non-hormonal medications as a personal choice, or it may be the case that hormone replacement therapy is contraindicated due, for example, to such conditions as a history of breast cancer or venous or arterial thromboembolic disease. The reason I'm going through this topic now is because there is a new non-hormonal drug that was recently licensed to treat symptoms of the menopause. This drug is fezolinetant. However, in this video, I want to talk about all the other non-hormonal medications that are already used for the symptoms of the menopause. In the next video, I will focus on fezolinetant. As always, all I'm about to say represents the current best practice, the evidence for which can be found in the description of this video. Okay, so we'll start with a reminder of the symptoms of the menopause. These can be divided into the following groups: vasomotor symptoms such as hot flashes, night sweats, sleep disturbance; psychological symptoms such as irritability, anxiety, and low mood; sexual desire symptoms such as low libido and low sex drive; vaginal symptoms including vaginal dryness, burning, itchiness, and painful sex; and physical symptoms such as fatigue, impaired memory and concentration, joint aches and pains, headaches, and urinary symptoms. The commonest of these symptoms are the vasomotor ones. All of the symptoms of the menopause come on as a result of the loss of ovarian follicular function, accompanied by shrinkage of the volume of the ovaries and a significant progressive decline in estrogen production from the ovaries. This decline in estrogen production may occur gradually due to the natural menopause, or may occur rapidly following surgical removal of the ovaries, or due to chemo or radiotherapy that affects the ovaries. So at the outset, it is important to remember that estrogen and hormone replacement therapy remains the most effective treatment for symptoms of the menopause. However, some women may not wish to be started on HRT or have contraindications to its use, as previously mentioned. And this is where these non-hormonal drugs come into play. The drugs that have shown significant benefits for menopausal symptoms compared to placebo include SSRIs, SNRIs, Gabapentin, Oxybutynin, and Clonidine. Within the SSRI group, escital-opram, paroxetine, and citalopram have shown significant benefits in improving the symptoms of the menopause. Fluoxetine and sertraline showed a trend towards symptom improvement, but this did not reach statistical significance. There is little in the way of trials directly comparing one SSRI with another, but indirect comparison indicates escital-opram and paroxetine show the most benefit. Within the SNRI group, both venlafaxine and desvenlafaxine have shown significant benefits in relief of menopausal symptoms compared to placebo. Both the SSRIs and SNRIs showed mild to moderate benefits in symptoms relief compared to placebo. Of note, patients who are on tamoxifen should not be prescribed either paroxetine or fluoxetine, as both of these drugs inhibit the cytochrome P450 enzyme system, and tamoxifen is a prodrug that is metabolized to its active metabolites by the cytochrome P450 enzymes. These two drugs therefore reduce the efficacy of tamoxifen and should be avoided in patients who are taking tamoxifen. This table shows the doses of the SSRIs and SNRIs that are used for treating symptoms of the menopause. Remember, another advantage of using the SSRIs and SNRIs is that they may also help stabilize the psychological symptoms that some women suffer with, such as irritability, anxiety, and low mood. Another drug that has been shown to significantly help the vasomotor symptoms is gabapentin. The dose is between 300 to 900 milligrams daily. Gabapentin seems to be as effective as venlafaxine in controlling the vasomotor symptoms. However, remember, gabapentin is more likely to cause side effects and carries the risk of dependence if it is misused. Next, oxybutynin is an anticholinergic drug. Oxybutynin has been shown to be significantly more effective than placebo in improving the symptoms of the menopause, but it does carry the risk of anticholinergic side effects. The dose of oxybutynin is 5 to 15 milligrams daily. Next is clonidine, which is a centrally acting alpha-2 adrenergic agonist. Clonidine is significantly more effective than placebo, but less effective than the SSRIs, SNRIs, and gabapentin, but with more potential for side effects. Therefore, it is only recommended to try clonidine if these medications are either ineffective or couldn't be tolerated. The dose of clonidine that is used to control the symptoms of the menopause is 100 to 150 micrograms daily. So, putting it all together, a suggested algorithm for the order of trialing of these drugs is as follows. This is based on the review by McCormick et al. With modifications. The reference for this review is included in the description to this video. Note that you move to trial the next drug down the list if the current drug the patient is trialing either proves ineffective in relieving the symptoms or the drug is not tolerated by the patient. Please remember that with all these tablets, it is important to start at the lower dose for each tablet and to follow up the patient in 2 to 4 weeks, and if needed, to gradually increase the dose as required up to the maximum dose depending on symptomatic benefits and on any side effects that may develop. If no benefit from or the patient is intolerant to the first medication tried, then another tablet can be tried. I hope you found this video helpful. Remember, the next video will be on the latest non-hormonal drug that was recently licensed for treating vasomotor symptoms of the menopause, and that is fezolinetant. Please don't forget to subscribe to the channel and turn on notifications so that you get an alert when the next video is published, and I'll see you in the next video.